Welcome and thanks for joining us for today's HIS Talk webinar. Do you really have a telehealth program or just video conferencing? It's brought to you by Mend. I'm Lori from HIS Talk and I'll be moderating. We have two speakers today. First up will be Nick Nerrell, who is the National Account Executive at Mend. Joining Nick will be JD McFarland, who's the Solutions Architect at Mend. And with that, I'll turn it over to you, Nick.
Thanks, Lori. So today we're here to talk about, do you really have a telehealth program or just video conferencing? My name is Nick Nerrell. I've been working in telehealth and patient engagement for the past 2 years, helping hundreds of organizations find virtual care solutions. If you ever reach out to Mend and happen to be east of the Mississippi, I'll have the pleasure of working with you. My role is to work with innovative healthcare executives to help them find new ways to treat patients at a time and place most convenient for the patient. I've worked with organizations like Optum WellMed, Albany Medical Center, MindPath Care Centers, Aharo, Ellis Medicine, and much, much more. And I'll let JD introduce himself.
Hi, my name is JD McFarland, and I've worked in healthcare information technology for the past 20 years. For the past 6 years, I served as Director of Information Technology at the Centers, Inc., a community mental health center located in Central Florida. During my time with the agency, we deployed several different telehealth solutions. In October of 2019, we switched to Mend for our telehealth services, and our agency converted to 100% telehealth during the COVID pandemic. I'll tell you a bit about my experience with Mend in a bit. In October, I was fortunate enough to join the Mend team. I look forward to helping other agencies transform their operations with Mend. Nick?
So while we'll briefly touch on how 2020 has changed telehealth, we all know that our primary focus is going to be the virtual care journey and how yours can become more efficient. You're going to want to stick around for today because at the end, we'll take a look at a quote from Legacy Health and their reason for implementing Mend as an Epic user. As a special thank you for staying around, we've got a free e-gift for users that will help them expand on lessons learned today. Telehealth is here to stay. There's no more asking which doctor's office is close to my house. It's now, who can I reach online easier? Nearly every organization I talk to at this point is now saying the same statement. We started out with X platform to get us through the pandemic. It's working okay, but we're not sure it's the best solution for the long term. I've actually had 3 calls today I've heard it on. Telehealth is now an expectation for organizations, and today we're going to help you round out your long-term telemedicine strategy and how your patient engagement tools will help complete your virtual care strategy. Who is Mend, and why should you listen to us? Founded in 2014, Mend is now the complete digital front door for an organization. We started out with telehealth as our first product and now have a variety of patient engagement tools to enrich the virtual care strategy of every organization we work with. We provide integrated solutions to allow healthcare organizations to better communicate with their patients so they can increase the quality of care they give. Everything from the very beginning of the visit to recalls and patient self-scheduling, through to forms, the visit itself, and even post-visit surveys. We help hundreds of organizations, thousands of providers, and millions of patients. We do about 1 million minutes of virtual visits every week. Mend works with healthcare organizations of all sizes, from solo practitioners to multi-hospital health systems, networks, and even insurance companies. And now I'll pass it over to JD.
So the slide says it all. 2020 was the year that changed telehealth forever. In my experience with my previous agency, we first got involved with telehealth in 2014 after receiving a $1 million SAMHSA grant. We used that money to spend we spent a lot of that money on enhanced IT infrastructure and a whole lot of it on a legacy, life-size, room-based teleconferencing system that we use to provide telehealth experiences to patients at remote sites. Back then, the hub and spoke model, as it was called, was the only thing we could get reimbursed for. We used that system and made the most of it, but it never really truly transformed our operations, nor did it transform the patient experience. We stuck with it for several years until 2018. The state of Florida Medicaid guidelines changed, and we were able to actually be reimbursed for we were actually able to be reimbursed for providing telehealth visits to clients in their homes or any other place. At that point, we tried a software vendor that completely failed. They couldn't successfully perform video visits. It was a terrible client experience. We ended up pivoting to using Microsoft Skype for Business and eventually Microsoft Teams. And then we pasted on our own or third-party digital signing platforms, reminder platforms, and it was basically becoming unmanageable. We couldn't grow the program, we couldn't scale it, and client experiences weren't very good. In October of 2019, we were fortunate enough to sign with Mend, and all those problems went away. We were very deliberate in the way we deployed our telehealth solutions with Mend. We selected a handful of med clinic providers that we were going to test with. Everything went beautifully. We were planning to slowly move more staff and more programs to Mend over the course of 2020. And then March happened. COVID changed everything, just like the slide says. In the first 2 weeks of March, we had massive regulatory barriers drop before us. We went from almost no private payers to, or I should say, no insurance payers to every insurance payer was going to be paying for telehealth. And we also had to struggle with how to safely operate our practice. We didn't have the PPE we needed to keep the place open, and we weren't going to be able to get it anytime soon. So we put all of our eggs in the basket with Mend. Our entire outpatient operation over about a week and a half transitioned from in-office to working from their homes. They literally took their laptops or their desktop computers home. Our IT team worked around the clock for about 1.5 weeks, getting people set up and comfortable. And everybody was fully immersed in Mend. We went from having less than 10 users to about 55 users. We expected the last 2 weeks in March to be abysmal from an operational performance standpoint. We were shocked when we saw that our no-show rate actually dropped, our provider productivity increased, and overall, despite everything going on in the world, March of 2020 was only 5%, had only 5% fewer visits than March of 2019. Over the next couple of months, these trends continued. We performed a client satisfaction survey in May, and we received the highest positive feedback score we'd ever received on any consumer satisfaction survey in the history of the agency. And it's important to note, in our agency, many of the customers are forced to use our services. They're either court ordered or the Department of Children and Family requires it as a condition of reunification with their families. So they're not particularly happy to be using us. And so for us to get an 88% satisfaction rating was a very big deal. Even more impressive was that those clients overwhelmingly wanted to continue using telehealth after COVID. Now would be a good time to share a few stats with you about the changes Mend saw during the same time frame. In February of 2020, they performed 11,833 visits through the platform. March, that number went up to 38,065. April of 2020, Mend performed nearly 100,000 visits in their platform. Where are we at today? In the last 30 days, we've performed over 5 million minutes of video visits, and it grows every month. The next slide is titled "Virtual Care is Here to Stay." I can tell you I absolutely believe that's true, but let's look at some of our customers. Lori J. Farrell, MD, Clinical Vice President, Legacy Health. I think virtual care is here to stay as people now realize how convenient healthcare can be without a lot of hassles. Hassles is a simple word for what many people, or what for many people ends up being major barriers. Healthcare clients often have special needs. They're at high risk factors, they face economic burdens. Things like taking time off from work can be a major barrier to treatment. In rural communities especially, a trip to the doctor might require half a day off work or more, not to mention half a tank of gas and maybe paying for daycare for the kids. These costs are a major factor in no-shows. They cause clients to drop out of care, outcomes to get worse, and that leads to worse reimbursements for your population. Clients suffering from depression and anxiety, they often have problems just leaving the house. Seniors and clients with compromised immune systems, they face a great risk with COVID-19, but that's only the latest risk. Things like the flu are still a killer in these populations, and they're going to be for a very, very long time. A chemotherapy patient will still be at a high risk long after COVID is gone, and finding a way to keep them out of unnecessary office visits so they don't sit in that waiting room full of sick people is going to be best practice from here on out. Now, telehealth obviously isn't for everyone or every procedure, but for many people, it's far more ideal than an office visit. Now that they've experienced it, they don't want to give it up. As I mentioned before, we saw that 88% of our customers at the centers wanted to keep using telehealth. Let's go into the 5 essential factors to think about when you're evaluating the use of telehealth technology. Real quick, that's ease of use, technical support, workflow flexibility, integration capability, and of course, cost. We'll go into depth on each of these. Ease of use and live support leads to better utilization. It's pretty basic, but if people can't use it, nothing else matters. In order to improve the usability of the platform, you have to think about where your patients and providers are going to be. They're not going to necessarily be in the perfect situation. They're not going to be in a beautiful brand new medical office building with a fiber internet connection. They're probably going to be on a cell phone, maybe in a rural area with a few bars of signal. How is that going to work for them? After COVID, a lot of providers went home. When they went home, how good is their internet? These are things to take into consideration. Your platform, or the platform you choose, needs to be able to operate on limited bandwidth. It needs to be flexible. It needs to be able to fail over to audio to at least maintain communication. You want to have device agnostic video technology. I hate to say it, but there are medical providers who think that FaceTime is an appropriate telehealth solution. There is no appropriate telehealth solution if you block out 65% of your users. You need to be able to work on Android, Apple, Windows, Macintosh, whatever the clients are likely to be using, you want a solution that works on all of it. Software downloads can be a barrier. We take for granted the ability to just click and download an application, but as many of you know, you're behind a corporate firewall, you don't have administrative privileges. It's not going to be easy for you to just install any application you want. And a lot of our clients suffering from crippling diseases, mental health issues, they're going to struggle the same ways. And instead of calling IT, they might be calling their grandkids for help. So removing that barrier makes adoption that much more likely. Portals and logins create frustration. How many of you can remember every password to all the health portals you've signed up for in the past few years? I know I can't. Mend patented a HIPAA compliant login process that uses a secure link and only requires the client's date of birth. Fortunately, most clients can remember their date of birth without any issues. This has radically reduced the burdens to our clients. They get in much easier, they experience fewer issues, they don't get frustrated, they have a better experience. I mentioned bandwidth requirements earlier, but the better and more efficient your app can operate, the better it's going to work. Live and instant technical support. This is something that really sets Mend apart from everybody else. If you're going to be doing telehealth, you have to have a plan for customer support. If your telehealth vendor isn't going to supply it, it sits on you. At Mend, we take that very, very seriously. We pride ourselves on providing world-class customer support that starts the first time a client receives an appointment reminder. They are prompted to test the app and make sure everything works for them. We don't want them testing at the moment they go to log into your appointment, because chances are it's not going to be fixed in time to keep that appointment. We don't want you to have a no-show. So the very first appointment reminder they get in every follow-up conversation has a link to test their video. Our clients can enable a permission or a toggle which forces clients to test their video in order to get into the session. That way, no one can ever be surprised that it's not working. And when they test, if they have a problem, Men's technical support is right there to help them with just a click. It goes farther than that, though. Our proactive technical support actually engages your providers when we at Men's see that they're having an issue. We don't wait for them to call us and say there's an issue. If we see that they've dropped a video 3 times in the past half hour, we'll reach out to them via chat. We can reach out to them via phone. We're going to find out what's going on and hopefully solve it before they even bother your help desk. Mend has a unique incubator program where partners who are going to go live on their software for the first 60 to 90 days, you have a dedicated team of support resources. The names don't change from phone call to phone call. We make sure that any problems you have are addressed. We hold the hands of your providers along the way. If something goes wrong at 8 o'clock at night, you know who to call. The same person's going to be answering the phone for you. And that makes it much, much easier and successful, or at least more successful deployments. Workflow flexibility and integration equals long-term adoption. Every practice is different, and telehealth needs to be flexible enough to accommodate different workflows. Without flexibility, telehealth costs you money. Even free video conferencing will cost you money if it makes your staff do more work. Can your telehealth vendor support multiple entities within a single health system? Can they help you report across all those entities while siloing PHI within those entities so people who don't need to access it can't access it? Can they integrate different EHRs within the same health system at the same time? Can they integrate with Salesforce so you have a top level view for your CSRs and other folks across the health system? Mend can do that. Digital forms are a major time saver. Standalone signature platforms can cost up to $80 per provider per month. They don't customize the forms for you. That's on your team. Patients are often left with a very, very poor user experience trying to navigate a multi-page PDF document designed for an 8.5 by 11 sheet of paper on a screen that's only 4 inches with signature lines throughout the form. You don't want that. These forms live in a separate system. They don't upload to the EHR automatically. That takes more time. Time equals money. The last thing you need in your practices is another cost. Mend solves all these problems through integration. Let's talk about some of those efficiencies in integration. So the last thing anybody wants is to maintain 2 schedules in their EHR and in their telehealth solution. That's a major loss of time, a possible source of errors. And once again, your time is money. You can't afford to lose any of it. The first scenario we can talk about and address is the master schedule in your telehealth or in your EHR migrating or importing into your telehealth platform. This is something we try to do for all of our customers. It means staff can keep working the same ways they always have. Call center reps and schedulers can work in the same systems they're already familiar with. They don't even need to be trained on the telehealth software. They don't need to think about it. They just schedule appointments. The data is sent from the EHR to Mend. Appointment reminders are triggered. Testing and visit links are sent out automatically. Forms can be triggered by specific appointment types, so you get the forms that are appropriate for those appointment types automatically. The same tasks performed by the same people get more work done faster. That's the way telehealth should work. The second scenario, data from the telehealth solution flowing to your patient record. This gives us some really powerful tools. Patients can initiate on-demand visits, and in certain EHRs, it'll even tell you the client's in their session and waiting for you. We can look at doing self-scheduling for clients. Self-scheduling is something that makes a lot of practices very nervous, and rightly so. It needs to be done on your terms. So with Mend, that means you can pick what kinds of appointments you want self-scheduling to be available for, what providers, what times, what conditions the clients have. We can create triages that will actually sort out clients who aren't appropriate for self-scheduling and get them to the appropriate resource. It's all about making the workflows that you have work in the digital space. Digital forms to the EHR, that's our third major integration we see on a regular basis. Healthcare loves paperwork. We have way too much of it, but we don't really have a choice. We have to collect it and we need to get it completed as quickly as possible, as simply as possible. A third-party solution can cost a lot of money. It's not going to have the integration. Something like Mend, it's built in. We're going to be able to make sure your clients can fill out a mobile optimized form. Because we're going to send them a link via text message, most of the time they're going to interact with it immediately. We found that 86% of our clients complete the forms that are requested from them within an hour. Compare that to third-party digital signature platforms. Think about how long then is it going to take for that document to get back in your record. With Mend, it's going to be instant. Or if you choose, your team will be able to review it and then send it to the EHR. Once again, we work around your workflows. We can even go so far as to collect discrete data elements on those forms. So clinical assessment data, for example, can be directly sent back to your EHR so that you can report off of it. You can follow quality measures, whatever you want to do with the data. It's all about time, and integration saves time. The hidden costs. So I've mentioned cost a lot throughout this, this presentation, and that's because in my previous life, I spent a lot of time dwelling on the cost of software, the cost of lost time, the cost of downtime. Let's talk about technical support first. If you have to add even one help desk technician to support your patients, you're looking at a minimum of $40,000 a year nationally. In high income areas, you can be looking at considerably higher. Digital paperwork. Third-party solutions cost between $40 to $80 per provider per month. Those costs add up quickly. When you look at the time that it takes to manually shuffle digital paperwork around, you then look at adding additional support staff. Very, very expensive. Standalone appointment reminders. Most of those services charge on a per message basis. So you don't know from month to month what you're necessarily going to be spending, but you can have a pretty good idea what you spent over the past year. As you're looking at your telehealth solutions, or looking for telehealth solutions, look at whether or not they actually address all of these areas, bundle it together, and give you a predictable bill. Telehealth appointment reminders, that's another key thing there I forgot to include. If patients aren't getting the reminders, if they aren't testing their technology, you're going to have no-shows. Your transition to a digital workflow will actually increase the amount of no-shows because you've got people experiencing technical problems for the first time. For the Mend approach of testing and engaging with the clients well before that appointment means you don't have those no-shows. So hopefully what you're going to see is you'll have reduced no-shows from technical issues, reduced no-shows from your baseline in care because people don't have to deal with transportation, additional time off from work, and whatever other burdens they might face. And No-shows as a whole cost the healthcare industry $1 billion a year. So if you can eliminate even 10% of your no-shows, think about how far that stretches around your budget. Let's talk about preparing to implement a telehealth solution. One of the keys to really being successful is good employee buy-in, and one of the most important things to accomplish that is involving all the stakeholders within your organization right up front. Now, I come from an IT background, so I'm kind of biased here, but I can tell you a lot of times IT gets left to the very end of these conversations. The same can be said for any other stakeholder. If they're not included at the beginning, bad solutions can get, or bad decisions can be made, and that can ultimately lead to very costly problems down the road. Each stakeholder should create a priority list, rank what they want, what they need. They should identify the things that they absolutely have to have and look at the things that maybe they can live without. You want to look at the training requirements for the individual staff who are going to be using the system. Clinical users and administrative users have different needs. They're going to use different parts of the systems. Your clinical users, these are the people who make you money. You don't want to take them out of a clinical setting for even a minute longer than you have to. You certainly don't want them to have to listen to how to run reports that they're never going to run in a part of the system they're never going to use. At MIN, we work with you to tailor the training specifically to meet the needs of your staff. The administrative folks learn how to use the tool from an administrative perspective. The clinical folks get a narrowed down training that teaches them what they need to know, gives them practical advice, and lets them get back to work and get back to making you money. Satisfaction surveys. You want to constantly be checking with your clients to know how you're doing. And increasingly, your reimbursements are based on client satisfaction. At MIN, we baked client satisfaction surveys right into the product. You're going to be able to find out how your clients are feeling about the telehealth experience throughout the platform or throughout the implementation. If you want to have them take a link and go to a third-party tool that collects more data, no problem, we can support that. Administrative reports. What is your team going to need to look at? What are the data elements that you have to report on? How are you going to measure success and failure? Who is and isn't using the platform? How are no-show rates doing amongst different providers? At MIN, once again, we build all that out. All of the metadata that we collect is reportable. This includes things like the number of sessions that are dropped due to technical issues, packet loss, flutter, all sorts of issues. You have the data at your disposal so that you can figure out how to best steer the program and develop it over time. Preparing for implementation, the IT infrastructure considerations. Like I said, I come from an IT background, and I can tell you when this gets overlooked, people end up making very expensive mistakes. So I mentioned already, many places sent their providers home earlier this year. The telehealth solutions that you pick have to be flexible enough to support this. That means, what devices are you actually going to have the telehealth being used on? If you have an inpatient setting, are you going to be using kiosks? Are you going to have iPads? Is the same solution going to be able to work across both of them? Are your providers going to be sitting at home using corporate assets, but using a VPN to log into it? Is your telehealth solution going to be flexible enough to tunnel through and work with VPN, or is it going to get confused and bog down and not work? What about RDP? A lot of EHRs use RDP solutions in order to access. How is that going to work side by side with your telehealth solution? All these things are things you want to identify and address as you're looking at vendors. How are they going to solve these problems for you? What about connected devices like stethoscopes and microscopes? How are they going to work with those? What technology is your patient population going to be using? I can tell you in the areas where I've worked, they don't always use the most brand new shiny iPhones. A lot of them are using quote Go phones and track phones that are Android designs, probably dating back 5 or 6 years. So you're going to want to find something that works with the population you're serving. And then once again, what is your plan for providing technical support? Nothing's worse as an IT leader than finding out at the end of the discussion that not only has a solution been selected, but oh yeah, now you're going to have to support it. You want to think about that up front and figure out how you're going to build it into your strategy. At this point, I'll throw it back to Nick and let him take over.
So now that we've gone through your implementation, thanks JD, what should the patient experience be like in virtual care? Now, this journey may not sound too different from your organization, but listen to each step and think about the amount of staff interaction that you currently have involved. How many of these steps require someone from your organization in order for them to be completed? So first, through traditional out-of-home advertising, social media campaigns, a patient's now attracted to your website. Now, using your new digital health tool to book an appointment, it should take just a minute or two after landing on your website for them to get that appointment booked. Then they're going to get all the required consents, forms sent right to their device, and they're receiving reminders leading up to the visit. After the visit's wrapped up, they get a short survey to give their feedback on the experience of the health system's new telehealth platform. And then later on down the road, they'll get a message it's time to schedule their follow-up where the pattern repeats itself again. The potential goals in all of this should, one, be reducing call center volume through things like patient self-scheduling and automated recalls, reducing no-shows through reminders, proactive technical support, reducing that technical support FTE the organization might have been staffing, all while increasing patient satisfaction. The first part of this journey that your technology platform will take over is patient self-scheduling. More than 2/3 of patients are likely to choose their providers based on this ability, and yet most healthcare organizations operate in one of three ways. One, there's a landing page with an appointment request form, or two, that landing page gives you information and then go ahead and call a number to schedule an appointment. Or three, and this is the most common ones I hear with larger organizations, is that they can go and either book or request an appointment through the patient portal. These all limit the autonomy the patient has in scheduling an appointment, and forcing it through the portal often limits self-scheduling to exclude new patients, perhaps the best group to have self-schedule and really generate leads for the organization. Now, I know autonomy and self-scheduling sounds crazy. However, there are tools out there that allow you to intelligently route patients to an appropriate appointment type and providers that can see that appointment type. That type of triaging is going to be critical in what self-scheduling platform you go with. Now, as seen in the photo, an easy to find button should take patients directly to this routing tool. Some sample questions include asking geography of the patient, the type of provider specialty they're hoping to see, a new or established patient, and the age of the patient. Just by asking questions like this, you can be filtered down to a pediatric neurologist that's accepting new patients for headaches at a location closest to you. And now that that patient's been routed appropriately, don't lose it in the final second. One of the most common things that I see is there's so much information that a healthcare organization wants to get before having the ability to book the appointment. Get the appointment booked and then follow up with any of the appropriate digital forms and clinical assessments that you want to collect prior to the visit. Now, almost 60% of Gen Y said they'd switch doctors for easier online access. Keeping this process efficient is going to help lead to better conversion rates in marketing, and an easy self-scheduling tool is going to help reduce that call center volume. One of the biggest time savers in your virtual care strategy is going to come from digital forms. So let's take a look at what that experience could look like for the patient in this video. They should get an email and a text where all they have to do is click on a link, enter in a date of birth, and that should give them access to the forms. There's no need for them to have to remember any complex usernames, passwords, or weird codes to get into the forms. And again, most of the organizations are still operating by having patients download PDFs from their site, or they can only be completed in the patient portal, something we all know gets dismal engagement rates. The patient's device is your new clipboard. As the video shows, the patient's going to receive the correct form via the appointment type, and then all they have to do is enter their date of birth for verification. There's no usernames or passwords as a barrier, and there's no apps that need downloaded either. This eliminates paper used, manual data entry, which costs time. It creates the possibility of human error. And as we looked at what the efficiencies and integration can create, any of the information captured in a form like this could be pushed back to the EHR or practice management system, and this completes your patient's account in your health record system ahead of the appointment. It can capture any consents your organization needs, and clients have been seen to reduce their check-in time by 10 to 15 minutes per patient. There's several key points in order to make the digital forms area of your digital health tool successful. One is going to be getting the appropriate forms automatically sent to the patient. Two, getting a high engagement rate thanks to an easy to use platform. Look out for easy e-sign, no logins and no downloads. And of course, the more integration capability, the better. Now, when we get to the virtual visit actually starts before the provider joins. Just like in an office waiting room, the patient should be greeted by a non-provider to review the consents that were e-signed or any of the intake forms that were completed. This ensures the same responsibilities that were had in an office are had in the virtual environment, maintaining your existing workflow. The same can be said for the end of the visit. The provider can transfer it back to a staff member for them to get a follow-up scheduled. This allows the provider to quickly move from one appointment to the next as needed. And the ability to transfer a patient makes it easier for a patient to interact with multiple providers in a single visit. They only need to join once, and yet they can go from a physician to a psychiatrist to a neurologist, all in a single appointment. And here's what some of those transfers could look like depending on what stage of the appointment you're at. Now, getting into the actual visit. Again, it should be just as easy as those forms. Get an email and text pushed out, and then all the patient should have to do is click a link and enter their date of birth. So there's no need to remember any weird video access codes or passwords to log into a portal for a virtual visit. Push it out to them and let it be based right in their browser. And now the rest of the encounter should replicate the quality of care delivered during an in-person experience, no matter the visit type, whether that's one-on-one, one provider with a family, or group visits for tumor boards, diabetes education, IOPs, and more. As we've discussed, the proactive technical support options should be given. However, technical support should be available on demand to ensure visits happen. So what else could happen in a visit? What if your patient runs out of data for the month? How is that going to be handled? Telehealth platforms are adding the ability to dial out. So you can dial out to a patient, or you could dial out to an interpretation service. These services are incredibly important to ensuring technology leaves no patient behind. Organizations like LanguageLine, Sierracom, and Stratus have also adapted workflows to include interpreters via video for patients that need ASL interpretation. Virtual visits are all about making the same quality of care more convenient to all patients. As we've really focused on technical support in the previous slide and several others, the reason for this is it could have the largest financial impact on your organization. I've heard from FQHCs and behavioral health organizations that up to 90% of all virtual visits during the pandemic were handled telephonically due to technical issues. Reimbursement via telephone is not going to last forever. Virtual care specific reminders are your organization's first line of defense. These reminders should include links to best practices and the ability to test your device on the platform. Does the webcam, the mic, the speakers, and internet connection all meet the requirements? This allows the patient to troubleshoot with the platform's technical support before the visit and before the provider would even know. Now, of course, on-demand technical support will always help. So can you reach someone in just seconds? And notice I always mention the platform taking responsibility for technical support. Your organization should not have to increase technical support FTEs for on-demand troubleshooting. So what happens when all of this comes together and it's integrated with your EHR? So we're going to start back at that out-of-home marketing, social media marketing to get a patient to the website. Your new patient self-scheduling tool will show patients the available appointment types based on that question tree and providers and what time slots they currently have open, so we're not doing any double booking. Based on the appointment type that gets booked, those digital forms are automatically getting sent out, so those can be completed. And the reminders are going to be sent out that include the ability to reschedule. Another area where you can minimize call center volume, because now patients can move their appointment from 10 a.m. to noon without having to call in. The provider and staff can conduct that visit and start it right from their EHR, so they can launch that video visit. Afterwards, the staff can be notified of satisfaction survey scores, and recalls are automated. So again, call center volume is reduced and patients can then self-schedule their follow-up. So why did Legacy Health, an Epic user, choose Mend? Here's a quote again from Dr. Lori Farrell, Clinical Vice President at Legacy Medical Group. Legacy Health came to Mend at the onset of the COVID-19 pandemic with a scenario that was nearly identical to hundreds of other groups that were frantically reaching out to us. Legacy already had a telehealth tool that was embedded in their EHR they had been sporadically using prior to the pandemic, as most groups were. When their volume spiked this year and thousands of their providers had to go nearly 100% virtual, they quickly realized their current solution was not going to be sustainable in the long term. Outside of severe connection issues that had most visits concluding in an audio-only phone call, there was a big learning curve for patients as well. Legacy services a broad patient demographic, some more technically literate than others, and a large percentage of their patients had trouble simply using the technology they had in place. The issues were so frequent, they were repurposing members of their team to be technical support resources for virtual connections. An entire team that were connecting with patients to walk them through how to set up their device, start the session, and ensure they could connect to the session. It wasn't sustainable and it wasn't an acceptable patient experience either. Legacy ultimately partnered with Mend because we solved most of the pressing pain points. It was the ease of use and the technical support. By having a tool that's incredibly simple to use, access with just clicking a link in a text or email as opposed to logging in, their technical support requests plummeted. There wasn't a need to have patients connect with someone prior to the visit. They could simply run a connection test prompted by the platform, and in the rare event there was an issue, Mend took on the responsibility for those live chat support requests. We were able to stand them up in a matter of days to help them treat their patients and are working towards a fully integrated solution with their EHR. Now, if you've stayed around this long, you deserve a gift. So we have a free ebook. Just go ahead and email JD or myself, and we'll shoot this over to you. Mine is just nnerl@mendfamily.com or jd@mendfamily.com. Thank you for watching, and I will pass it back over to Lori.
Thank you, Nick. As a reminder, we'd like to open it up to questions from the audience. You can use the questions section in the GoToWebinar panel to submit your questions. The first question, Victor would like to know which of the hidden costs are providers generally losing the most money on, and on average, how much is that?
This is JD. I can jump in and try and answer that. I would say the technical support is one that gets a lot of people. And so far as the cost, like I said, on the low end, if you have to hire anyone, it's going to be about $40K a year by the time you factor in all their benefits on the low side, and multiply that by the size of your patient population. When my agency was doing it, we had roughly 13,000 or so outpatient clients a year, and we found that we had to basically dedicate one full-time position to phone support for technical support issues with the clients. And when we went to Mend, we were able to make that go away. So if you're seeing 130,000, those costs are going to go up even higher. So that's something I think is very important to factor in, and it's a huge hidden cost.
Okay, Ray would like to know, what are the implementation costs roughly for a 300-bed hospital using Epic?
That's a great question. This is Nick, and that's really going to depend on the platform you end up moving forward with. Some do have one-time implementation fees and some don't. A platform like Mend, we are really just on a per provider license or a per visit model with a integration fee that is dependent on Epic. So most organizations can look at a $39 to $79 license per provider.
Okay. What are the most common struggles during the implementation process?
I would say working out transitioning physical in-person workflows to a digital environment. A lot of times, number one, you have the good problem of the software works better than expected, and you have to come up with new ways to take advantage of those efficiencies, or you have software that's working worse than expected, and you're having to create new workflows to accommodate the problems or overcome the problems that the software has caused. In my experience, I definitely had both of those to contend with. And after having to come up with a lot of solutions to problems I didn't expect, the transition to working with a partner like Mend, where we basically had the opposite problem, now we have tools at our disposal that lets us be more efficient, was a really, really welcome surprise.
What marketing responsibilities can a healthcare organization take on to make their telehealth program more effective?
This is a really good question and something that we've seen really impact an organization's launch with telemedicine. First, the marketing website can be a great place for a dedicated landing page around telehealth. A current client of Mend, MindPath Care Centers, does a great job of this by outlining what patients can expect to see in a telehealth visit and how to get them best set up. Many telehealth platforms also have waiting pages that allow you to basically create a dedicated microsite for that patient as well that can walk them through best practices, technical support. So the marketing website is going to be a great place to start.
Our health system already has technical support staff for other necessary items. Why wouldn't it make sense to bring this in-house as well?
I can field that. You certainly can do that, but chances are all those people who are already working on something or that you already have working for you already have a job they're doing. And if you're supporting a 500-bed hospital somewhere with several thousand staff, bringing on another 20 or 30,000 clients that you're going to support isn't going to be something that you're just going to be able to roll into your existing workflows. You're going to have to add people. They're going to have different training, because the kind of support they're doing right now is probably a little bit different from this. And really, essentially, you're looking at creating a new specialty within your help desk. And that's not something that most people want to do. And of course, there's a bill that comes associated with each new FTE you add. And as I said earlier, those costs add up.
Okay, well, that was our last question. So we'll conclude our webinar. I want to thank everyone for joining us today, and thank you, Nick and JD, for an interesting and informative presentation. We look forward to seeing you at our next HIS Talk webinar. Enjoy the rest of the day.